A lot of my girlfriends have been singing the praises of hormone replacement therapy as they approach the change of life, better known as menopause. To learn more about it, we're here at Advanced Women's Health. We're speaking with OBGYN Dr. David Goss, who specializes in hormone replacement therapy and a chip implant procedure that's very popular that will help us all feel GenXtra. Thank you so much for joining us, Dr. Goss.
Very nice to be here, Karen.
Dr. Goss, what is hormone replacement therapy and how does it work?
Well, Karen, when an infant girl is born, she has in her ovaries all the eggs she will ever have. No more eggs after birth. They're all there at the start. And then over 50 years or so, the number of those eggs gradually diminishes and gradually diminishes. And in the early 50s, in most women, the eggs are gone. The part of the ovary that is responsible for egg production is also responsible for what we commonly call the female hormones, estrogen and progesterone. So when the tissue that makes the eggs is gone, the tissue that makes your estrogen and progesterone is gone. And many women feel symptoms related to that drop of estrogen. And hormone replacement therapy is the idea of using some external source to put those hormones back in your body to help alleviate those symptoms you might be experiencing. This is an example of the pellet, so you can see the size. This is a fairly large pellet. This is a testosterone pellet. So if you're just getting estrogen, your pellet will be about that big again, if you want to see compared to my finger.
Why do we implant in the buttocks area as opposed to somewhere else?
It gives you a fair amount of fat tissue to bury the little implant into so it won't protrude or push back out through the skin. Then we numb things up a little bit, so Allie, you're going to feel a stingy sensation. You okay?
Yes.
The initial skin injection there tends to sting. Once that's done, the rest is fairly painless. It looks awful with a big needle going in there, but is that hurting a lot, Allie?
No.
No. Then we just make a small incision here. The incision is so small she won't require a stitch or anything. So this is the device that delivers the pellet. You see it has a little opening there so I can slide the pellet into it, as you'll see in a moment. We just kind of slide this in. And again, it may look like that's quite painful, but is that hurting, Allie?
Not at all.
No. So you see the two pellets are in there now, and this is just a little plunger. Plunge the pellet in. Move the livers. So now the pellets are in here.
And how often does she return to you to get the pellets replaced?
On average, it's about every 3 months, but for my patients, I tell them to return for symptoms. So say that after 4 months you're feeling great, I would not recommend coming back and getting another pellet just because it's time. Most people will notice the symptoms beginning to redevelop in 3 to 4 months. The pellet uses a compacted pellet of the hormone, highly concentrated, and it's inserted, as you saw, underneath the skin. By doing it that way, you provide a longer term of therapy. With a pill, you have to take the pill every day. Also, you bypass, by doing that type of therapy, the digestive system. And there's evidence that by bypassing the digestive system, the use of the hormone therapy becomes less risky. It avoids certain risks associated with oral ingestion of hormones. Remember, we talked about hormone replacement therapy. The situation with testosterone is a little different because the testosterone is not necessarily related to the egg-making process in the ovaries. Testosterone is produced by the non-egg-making portion of the ovaries, so you don't see the same abrupt decline with menopause that you do with respect to estrogen and progesterone, but there is a gradual decline with age. Also with estrogen, we try and replicate the kind of levels you would normally see in a younger woman. With testosterone, you actually elevate the levels a little above what you would see in an average female of that age group. But yes, the idea is we are replacing estrogen and we're more like supplementing testosterone.
Dr. Goss, thank you so much for answering all of our questions about hormone replacement therapy. Now, if you want to learn more about how you too can feel GenXtra, check out the website below.